Not every diarrhea you have, you rush to take an antibiotic, you rush to take flagyl, you rush to take tetracycline. Some of the diarrhea you experience may be as a result of lactose intolerance. So today, that brings us to the topic we're going to be discussing in this video, lactose intolerance. So what is lactose intolerance? Lactose intolerance is a condition where an individual is unable to digest lactose. Lactose is a form of sugar found in milk or dairy product. So now when someone have inadequate amount of lactase, which is the enzyme that breaks down lactose, that person may end up developing a condition called lactose intolerance. Do you wonder how the solid food you take gets into a smaller particles when you go to the toilet and you see little pieces around? It's because of the enzymes. Each food we consume has its own enzyme that breaks down this food into smaller particles so that the body can use. The carbohydrates, the protein, fats, all of them has its own enzymes. Anything that we consume that comes out whole when we go to the toilet, simply the body is simply telling you that we don't have a particular enzyme that breaks down that particular substance. In this case of lactose intolerance, or in this case of lactose, the enzyme that is responsible for breaking down lactose into smaller units of glucose and galactose is called the lactase. So what are the symptoms of lactose intolerance? First, we have diarrhea, we have emesis, that is vomiting, we have nausea. Nausea is simply the feeling to vomit. We have abdominal cramps, like stomach pain. We have bloating, which is excessive gas in the stomach. And then there are risk factors of lactose intolerance. What are risk factors? Risk factors are simply things that makes you prone or easily develop a particular ailment. So for lactose intolerance, the risk factors are age. When you advance in age, you are more prone to this lactose intolerance. We have ethnicity or race. Africans, Asians are more prone to lactose intolerance. Okay, so we also have giving birth to a child prematurely. So when you give birth to a child prematurely, this child has not developed enough cells in their small intestine to produce lactase until third trimester. Then we also have disease conditions of the small intestine. There are some persons, when they are infected with some certain kind of bacteria in their intestine, they find it very difficult to digest lactose because the cells that are responsible for producing this lactase enzyme for digestion of this lactose becomes impaired because of the disease condition. Then let's move into the prevention. To prevent lactose intolerance, you simply take milk that contains less amount of lactose or addition of lactase enzyme to milk or dairy substances. So for the treatment, when you're experiencing any of these symptoms, I will advise you consult a healthcare personnel. But if the symptoms persist and they are more severe and the healthcare professional is not readily available, and the person is kind of so much dehydrated due to vomiting and diarrhea, always try to get an ORS, oral rehydration salt, to give to the person as a first aid treatment while seeking or waiting to meet a healthcare professional. Thank you for watching. Keep on watching Pharmacist Carve TV. Share this video. You may be helping someone out there. And follow Pharmacist Carve on all social media platforms. Thank you. Cheers, Pharmacist Carve.